to go ahead and get started with today's training, which is going to be how to take an application. We're going to walk through the paperwork. Now, just as a disclaimer, we are using a 2017 Medicare Advantage plan for United Healthcare in Arizona. So this is going to change from carrier to carrier and from product to product. You have different applications for Medicare Advantage, Medicare Supplement, the dual plan, and prescription drugs. Right now, we're going to focus on the Medicare Advantage plan through United Healthcare, and we're going to start off with the scope. Again, we'll go through other applications later, but for right now, they all pretty much require the same stuff, the same kind of information. I mean, they're all going to want to know their names, date of birth, and basic background and history of their health, even though for Medicare Advantage, it's not a underwriting question, except for one portion and one question that we'll go through in just a minute. So we're going to start off. These are all located in the back of your enrollment kits for this plan for United Healthcare. Others come separately. Like I said, every single plan differs. Some may come as a tearaway, 2 or 3 page application where you leave one with the beneficiary and everything. This one's straightforward, very simple. This just so happens to be in the back of the enrollment kit. So first and foremost, we're going to go over the scope of appointment confirmation form. If for whatever reason you did not receive the scope of appointment prior to the meeting and you need to get a scope of appointment, it's going to be here in the application. You're going to be able to find that in the very back of the book right before the actual application process. So one of the things that we got to do is we got to make sure that we have the right scope and the right information. One thing I like to do is I just like to really point out to the people that, hey, you know what? This is a scope of appointment. I'm required to keep it for at least 10 years through CMS regulations. But right here, it says, by signing this form, you agree with a licensed sales representative to discuss the types of products that we checked above. Now, that's me. I'm an agent. This is what I do for work. And I'm here to help you out, and educate you on your options. But the most important thing about this paper is right here, by signing this form, it does not obligate you to enroll in a plan or affect your current or future Medicare enrollment or enroll you into a Medicare plan. This is strictly just giving me permission to talk to you. And that's usually how I lay it out there, because sometimes people don't want to sign anything before they actually hear the information, which makes sense. That's awesome that people are conscious about the fact that they probably shouldn't be signing paperwork unless they know what it is that they're getting into. So I let them know that, hey, this is just giving me permission to talk to them. And so we want to make sure that if we're going to go over a Part D prescription drug plan, that you have that checked. Medicare sales plan or Medicare Advantage plans, Part C's, dental, vision, hearing, whether it's hospital indemnity, Medicare supplements, or Medigap products. So for this training right here, we're going to make sure that Medicare Advantage is checked. And then what we're going to do is we're going to have them sign right here where it's their signature. They are going to date it right there. And I get this question quite often, and this is going to mimic what is shown on the application itself. And so it's very important to really know this very small distinction. So what we want to do is we want to make sure that we have all the information correct. And if you are an authorized representative, please sign above and print clearly and legibly below. So this right here is only going to be in case somebody has a power of attorney. There's no reason for anyone to sign this outside of a power of attorney. They don't need to re-put in their own name, first and last name, relationship to beneficiary doesn't make sense. You can't really put self because that's not made for them. So you want to make sure that that's a very common question I get. So I want to make sure that you guys understand that. So if the member themselves are signing up themselves and they're talking and signing in their own behalf, then this portion right here is not needed. This is strictly, again, for anyone with a power of attorney or anyone who can sign on their behalf. If that's the case, then I would put Marcos Alcantar. I would sign my own name, and then I would put my first name, last name, and relationship to the individual. The rest of this right here to be completed by licensed sales representative. This does not have to be done right then at the appointment. It has to be done, though, prior to you going through and submitting the application. It all needs to be filled out correctly. So this is going to be your first name and last name. This is going to be your phone number. This is going to be your ID number, so your writing number. And then it's going to ask, who is this for? What's the beneficiary's name? Who did you meet with? What is their phone number? When was the application, when was the date of the appointment completed? Now, By definition, you should have this signature date within 48 hours prior to the date appointed, the appointment actually took place. So those two dates need to correlate in regards to the timeframes. If they don't and they're same day appointments, I'll show you exactly how that's done. So this is optional information, their address and everything like that. Initial method of contact. How did you reach these individuals? How did you get a hold of them? Was it at a booth? Was it a referral? You know, what happened that you guys actually were able to talk to and meet with them? And then the plan that you actually represented, because you can only represent one plan, one product at a time, you need to go ahead and specify what plan that is. In this plan, it's going to be the United Healthcare AARP Medicare Complete Plan. Then we're going to assign it. And as you can see right here, it's going to say, okay, if you did not get the scope of appointment prior to the meeting, what happened? Why was it not collected prior to the meeting? Was it an unplanned attendee for somebody who walked into one of your presentations? Was it a new scope of appointment that was required? Maybe they had asked you to come and talk to them about one company with a Humana, and all of a sudden you're now representing United Healthcare, and you didn't have enough time to kind of let that 48 hours cool off. You don't actually need that, and I'll explain that later, but they're going to ask, you know, maybe it was a Part D plan and a supplement plan, and they wanted you to go over a Medicare Advantage plan. So what we're going to do is we're going to go through and we're going to have the scope of appointment, and we're going to get that filled out prior to the meetings. And if not, then we need to identify the reason as to why we didn't have it. So most of the time with a lot of these individuals, when it comes down to it, we really just put other, and maybe it was the member requested same day appointment or next day appointment. You got to be careful with that. Medicare will kind of crack down on, depending on how many of those that you continue to send in saying, hey, all my members wanted to meet today, you know. So you really got to be careful with that, because the rule is you need to have these two signature dates different. The 48-hour rule applies, and so you're going to have these two dates different. And if not, we need to put an explanation. And the only loophole is if a member requests that you have either a same day appointment or next day appointment, that you're unable to get that scope of appointment out in the mail prior to going out and visiting with them. So that needs to be explained right there. It always needs to have some type of explanation. And then you're going to go ahead and fax that scope of appointment into a different number, as you notice, than with most of the Medicare Advantage plans that you're submitting it to. Sometimes they can go together depending on the plan. So now that the scope of appointment, the front page is out of the way, we need to specify what plan is it. Because if you look right here, and a lot of people don't do that, it says that we actually have to indicate what plan that we're interested in right here. So we know that's a Medicare Advantage plan. And then right here, it's going to talk to us about what type of plan are we talking about. And so what usually happens is we'll go ahead and get them to initial somewhere right here on the side. That way it explains exactly what type of plan are we going to represent. It is going to be a Medicare Health Maintenance Organization, which is an HMO. It's a Medicare Advantage plan that provides all original Medicare Part A and B health coverage, and sometimes covers Part D, prescription drug coverage. In most HMOs, you can only get your care from doctors or hospitals in the plan's network, except for in emergencies. You want to explain it to them, let them know, hey, this is what we're going to be going over. It's an HMO plan. We're going to go over some of the details of what this plan covers. And so that way they know and understand exactly what you are getting into when you start talking to benefits. So that's really all you need for the scope of appointment. And you're going to tuck that to the side, or you're going to keep it with you if you received it prior to the application. And then you're going to go ahead and give your presentation. You're going to talk to them, explain the benefits, ask the questions, be engaged, find out what they need. And if at the end everything sounds good and they want to go ahead and enroll, then what we do is we come over here to the actual enrollment request form. So a couple disclaimers. Again, this plan is a United Healthcare Plan 1. Sometimes plans will have multiple plans right here or multiple riders. Oh, there's these right there. So a dental premium platinum rider. So if they did want to add any other type of additional benefits, or if there was one specific plan out of multiple plans listed here, you need to make sure that you check the correct one. And then if they do want it, you want to make sure that you check the any type of riders that they do want. Very, very basic information, where this information is going to be all about the client. It's very easy. You can get it off of their mail. You can get it off their ID, anything like that. You can go ahead and pull, and it's going to be their last name and their first name. Typically, this is going to be anything that is on their Medicare card. That's what I usually do. First name, last name. If it's spelt, or excuse me, just spell it like it's on there. I have a lot of individuals who run into different people who may have never changed their name as a married individual. Maybe they are, I run into this a whole lot, especially in Arizona, part of the Hispanic community, where, you know, they have one name as their last name, but yet their fathers and their mothers, and it's just kind of confusing of which one they actually go by. It doesn't matter what they go by, whether, and this also goes for their first name. If they go by Bob and they're William, it doesn't matter if their license says Bob. If their Medicare card says William, it has to be filled out as William, and then their last name. There you're going to have their date of birth right here, whether they're male or female, their main phone number. If they want to go ahead and list a second number, that's fine. You can go ahead and put it down there. Now, one of the things is you have to have on the application is a permanent resident street address. It doesn't matter if they don't get their mail there. It doesn't matter if they have a P.O. box somewhere else, if it's not even in state, or they're sending it to their brothers or sisters or mom's house. It doesn't matter. They have to have their permanent resident address that's listed with Social Security and Medicare. Now, once you fill that out, if they have a different address, a mailing address that's different, then you go ahead and fill this information out. If they don't and it's the same, just leave it blank. Very, very simple. Every application is different. This one just so happens to want you to have their enrollee name at the bottom of every single application. So in case these pages get mixed up when they're printing or the carrier goes through, they can know who to go through, who the client is and what paper goes into which one. So sometimes you'll have different options. I hear go get plan materials online. Well, different plans have different things. That right there is it's a variable. You know, every plan can be different. But this one right here, every single plan is going to want to know this information, and you have to fill it out exactly like it's on their Medicare card. Now, one of the big questions that I get all the time is, well, they didn't have their Medicare card. Okay, so that's fine. You can call 1-800-MEDICARE right here, this information. So 1-800-633-4227, and you will be able to get that information as long as the client is there with you. You want to know their name, male and female, their Medicare claim number, their Part A and Part B effective date. You're going to have to copy that exactly like it is off the card. So many plans have premiums and many plans have riders. And so they're going to ask you if you have a monthly plan premium, or in case you want any type of additional riders, you can go ahead and pay the following ways, which are mail order, bank account information through EFT, which is automatic deductions. You can have, in some cases, have it deducted from your Social Security or your railroad retirement benefits each month. So you can go ahead and click right here, which are check mark which one you want. I want to pay directly from my bank account. It's going to be a checking and a savings account number. You're going to have to write all their information in there if you'd like to, if that's one option. Yeah, you do not need to collect a check for this Medicare Advantage plan. Especially if it's a zero premium, you don't have to do that. Or even if it's a rider that somebody has that they're adding on to it that costs $15, $20 a month, you do not need to get a check for that right then and there. But they do have to sign it right there and date it. Like I said, many individuals, another option is you can go ahead and have it deducted from Social Security. And that's completely up to their option if they want to. Some plans allow it, some plans don't. You just want to check with the exact carrier and see what they do have. Or they can do a simple pay by mail. They'll send them a bill every single month, and you turn around and send it right back in. So that right there, in my opinion, is the most easiest way for us as agents to to advise our clients to take care of their monthly bill. Because what ends up happening is if something messes up and they don't pull out of their Social Security, or they don't pay it out of their pull out of their banking account information correctly, we may have a lapse in coverage. And I, as an agent, am more concerned about their health insurance than I am about typing in this banking account writing and a routing number and account number, or making sure I chose one of the options correctly and didn't mess it up. Than actually, having to worry about that. So I'm more concerned about their health insurance. And so I usually tell my clients to go ahead, and we're going to go ahead and pay by mail, which means they'll get a bill in the mail for their monthly premium or their monthly riders. So it doesn't matter, whichever they choose. If they have one, then they can go ahead and call customer service and get that issued and set up any way that they would like to, because it's a lot more simple with customer service on the line. So that's what I always suggest my clients do. So every carrier is going to have different information that you need to go through. We're just seriously going page by page, making sure that everything is being covered for. If you go through all of this information, your first couple of times, it may seem like a lot, but I promise you'll be able to get through it a lot faster as you enroll more individuals. And again, like I said, every company is different. So you're going to come over here where individuals are going to actually be advised that if they need help with prescription drug costs, they can go ahead and call Social Security office. It's going to list a couple of the numbers there. They can go ahead and apply for extra help online, which is the LIS program. And so we can go ahead and advise them of that. And then we're going to have a few questions that individuals are going to have to answer. Usually we know the answers because we've already given them the whole spiel about what the benefits are, the good, the bad, the ugly, all of that about the plan benefits. And so we should know by then a little bit more about their health benefits or their health. And so we're going to go ahead and go through this and know what their situation is and get through this and ask them these questions. So first and foremost, the number one question is, would you prefer this plan information in another language or format? And then if they don't, obviously, you're just going to fill in the information. If they want Spanish or any other type of language, they can go ahead and you can put down what type of language they're looking for. One of the big questions is, do you have end-stage renal disease? That is kidney failure, dialysis, anything like that. They're going to have the doctor check. They're going to have to check with the doctor if the answer is yes. And if the answer is yes, you can put the name of the company and the member ID and check yes on that. That is one of the underwriting questions that individuals, if they have end-stage renal disease, that they will have to answer. If they answer yes, typically they will not be approved to go in with this plan, the Medicare Advantage plan. There's a lot of expenses that go along with the Medicare Advantage plans and end-stage renal disease. So we're going to want to make sure that nothing gets messed up with those individuals. So definitely there is a way around it. And then we're going to have a section about end-stage renal disease and how to help those individuals and what kind of loopholes they have. But for the majority of the individuals, if they do not have end-stage renal disease, then you're going to just mark no and continue on down. They're going to ask, are you enrolled in the state Medicaid program? If they are, then you're going to put their Medicaid number right there. If they're not, then continue checking no and continue going on. Do you live in a nursing home or long-term care facility? Again, if the answer is yes, fill out the appropriate information. If no, check no and continue on. Do you have health insurance with an employer or union right now? So this is something that I get a lot of questions on. This is very important. They want to really stress the fact that if yes, you could lose that plan if you join this plan. Please talk to your employer or union. Ask how joining this plan could affect your current plan. Okay, so they want to go through and verify with their HR department. How does that work? Now, this right here is what a lot of agents get hung up on. Do you have health insurance? Now, if somebody's retiring in 3 months, they're going to say, yeah, I got health insurance right now. That's not what this question is really asking. It's saying, okay, if you are to drop your health insurance through your employer plan and pick up the next day, because remember, the plans always start the first of the following month. So if you're going to drop your plan the 31st of October, starting November 1st, when your Medicare starts and this plan starts, will you have any other insurance at the same time? And the answer is typically no, because remember, they're losing their group employer plan and joining the Medicare Advantage plan. That's why they have this particular question. Also, there's going to be another one that is going to be talking about prescription drugs with the VA in just a second, and we'll get to that. So completely separate, but they follow the same guidelines. So this is going to be, do you have health insurance? Do you or your spouse work? Again, please don't read any more into these questions than what it really says. You know, do you or your spouse have other health insurance that will cover your medical services? Again, please remember, very important, very simple, that somebody may say, well, you know what, I work part-time, I work 10 hours here, I get paid cash there. No, they want to know, is anything going to interrupt your health insurance, your medical services, your medical insurance? Is there somebody else that's going to be a primary insurance plan that you could lose? Again, same situation. If their employer plan stops October 31st and their Medicare plan starts November 1st, the answer is no. They are not going to have any other type of insurance plans at that time. There's no double coverage. There's nothing like that. It also asks about VA benefits and everything. We're going to go into that. It's a very, very, very simple answer. If they are losing one plan and jumping to the next one, the answer is no. They will not have it at the time their Medicare plan starts. It doesn't matter about right now. It matters about when their Medicare plan starts. Will they have additional coverage? So a lot of questions come around that. I promise you, if you can just really grasp that concept right there, it'll save you a lot of phone calls trying to figure out, is this the right answer? Did I answer this correctly? What's the loophole? It's very simple. It's going to be, do you or your spouse work? Do you receive any other? They don't care if they work per se, but they want to know, do they have any other health insurance through a group employer plan? That's what they're really after. Do you have other insurances that will cover your prescription drugs? Again, this is TRICARE, federal employee benefits, VA benefits, or anything like that. The answer is going to be no for everything that we mentioned before, if their plan is going to stop as their Medicare picks up. If they do have any other type of insurance, especially something like VA, that's important to note. You can go ahead and put that down, because if somebody does have it and you're enrolling them into a plan, then what's going to end up happening is they could incur a late enrollment penalty if everything's not documented properly. So make sure that's in there. They should have all their insurance plans, their member IDs and their group numbers and everything like that. So you want to make sure you fill out all that information correctly. The next one is the choice of a primary care physician. Because this is an HMO plan, we want to make sure that there is a provider that's assigned to these individuals. So you're going to find out, do they currently have a provider? If they do, fill out the current information. Look on the United Healthcare or the carriers and provider directory online. Go in there, pull up their full name, their phone number, and their PCP ID number. And it says, are you seeing this doctor? Have you recently seen this doctor? The answer is yes. Here's something important. If they say, you know what, I never see the Dr. Marcos, I don't really have one. Because it is an HMO, I let them know, okay, I'm glad you've been healthy. I'm glad that you haven't needed to see the doctor. However, because this is an HMO, you will be assigned a doctor automatically. Because what I'm going to do here is right here where it says provider or PCP full name, I'm going to put auto assign or member requested auto assign near residence. That's something that I always put. Member requested auto assign near residence. That way, whoever's taking this in and inputting into the system, they know that they're going to have to automatically assign that person. And hopefully they're smart enough to realize that they want somebody nearby. And so, that's what we usually do, is when they do not have a PCP provider that they go see on a continual basis, or even if they want to switch and they don't have an idea of who they want, then you can go ahead and auto assign them. You have to fill this out. I've seen so many applications not only get hung up in the queue for being fixed because there was no PCP information available, or even just flat out lost because agents never reached out to the company, the provider, to find out what was going on and how come it wasn't issued. And so what we're going to want to do is make sure that all of this stuff is taken care of, and we don't have to worry about any type of hold up on these applications, and our clients can get the services started when they're supposed to start on the correct date. Again, if you go through all this information right here, please read and sign. I usually read it along with them and explain it to them. Again, once you have been doing it for a while, you will understand what all of this stuff is, and you can kind of go through it, highlight it with them, explain it to them, make sure that they understand what they're doing. If you do follow all this information, it is going to be extremely hard for you to really honestly receive a complaint. Or if they do complain and the member says, hey, I didn't understand something, it's like, hey, you went through the whole enrollment form with me. We explained everything. Not saying people are not going to have questions, or not saying that people are going to forget, down in the future, but all this information, as long as you go through it, you're being compliant. So right here, signature of application. I like to let individuals know, okay, remember the scope of appointment? How that signature was to give me permission to talk to you. This plan is actually saying, yeah, you know what? I like this plan. Let's go ahead and get started with it. And so by doing that, we're going to go ahead and enroll you into this plan. All I need is a signature right here and today's date. Again, like we mentioned earlier on the scope, if you are an authorized representative, please sign above and complete the information. If I had power of attorney for my wife or my parents or someone, a family member or anything like that, I would have to go ahead and sign right there, date it right there, and fill out all this information. Now, every single one of these applications is going to be a little different. So this is the last page, and I'm going to brief just highlight a handful of things that are pretty typical on most applications. But for example, right now, even though they may be changing from one plan to the next, which is a Humana to a United, or a United Plan 1 to Plan 2, always put new member. Unless you're instructed otherwise by the carrier, this is typically what it is. It's that they are a new member to that particular plan. The plan, it may be within the same company, but just a different plan. And so you're going to go ahead and put new member. Now, what we're going to do here as well is this does not apply to us as agents, so we do not have to worry about that right this second. There is no employer group name, employer group ID, or branch ID. So it's going to ask us on most of these applications, how did this application originate? Where did you get it? Was it retail, mail program, member meeting, local event, community meeting, a local business outreach? I've never really done half of these, to be honest with you. They're all in-home appointments, or there were referrals or something like that. If it was a dentist office and it was referral, just click other. That's all you need to do. And how is this submitted? By appointment? Was it a mail, a fax, email? How is this application received? Did they mail it in? If so, that's great. We'll go over some of that information on how to date the mailed in applications versus when you actually receive it. And so it's going to be appointment in this case, in this scenario, and we're going to sign it right here. We're going to put the day that we actually take the application into our hands. And so, yes, that's going to, once you take that application into your hands and you sign it and you put the receipt date, that's when the clock starts ticking. And you typically are going to have 24 hours to turn that into the carrier so they can submit it to Medicare and get the member approved. Then you're going to go down here, that's your writing ID, your name, proposed effective date. Remember, all plans, it doesn't matter what they are, all plans start the first of the following month. So if we're in October, the proposed effective date is going to be November. If it's an AEP application, it's going to be January 1. If they have, if they're turning 65 again in November, then you're going to want it November 1st. So you really want to make sure that you have the proposed effective date down correctly, because again, it could snag up the application for no reason at all. And then they're going to have to send out letters to your clients and say, hey, can you give us some better clarification? There is no backdating of applications. It doesn't matter if it's the second of the month. You cannot backdate it and say it's the first of the month. It always goes into effect the first of the following month, no backdating whatsoever. The other thing that you're going to need to do is fill out your information. And this is another thing that hangs up a lot of applications, is choosing the correct special enrollment period election. So we have lots of information about all of this stuff on our website and the rest of our trainings. Which one of these does somebody qualify for? It's very simple. You're going to go ahead and click their SCP chronic or IEP. It's an AEP. All of these right here, I would strongly suggest going and watching our SCP trainings to really figure that out. But you're going to check that right there, and then you're going to sign it right there. Once you sign it, that's it. That's everything. That is all you need, and then you're going to go and turn that information in to the carrier, submit it via fax or any other type of forms that they accept, and you're going to go ahead and get that information turned to the carrier. The carrier is going to turn it into Medicare, and Medicare is going to go ahead and approve it. One, you get paid your commissions, and two, your client gets enrolled into the plan effective your proposed effective date. So all you need to do is go take it page by page. It's very simple. We'll go over a couple of different applications. I want you guys to get very familiar with these applications. After you do them a couple of times, it really is very simple. Do not read into it. Don't, any more than what it is. That's literally written in black and white. Answer the question just how it is, but understand what they're trying to ask. And so don't make it complicated. And if you have questions, give us a call. Reach out to the carrier. But this is how we make our money, by taking applications and submitting into the carriers. So be on the watch for our other applications and how to take those. We're going to cover supplement applications. We're going to cover prescription drug applications and the dual application. And you'll see that once we go through a handful of these, they're all the same after that. There's a few companies that require a couple things different, but honestly, they're all the same. So thanks for joining us, and good luck.